Understanding the COVID-19 vaccines. Answers to 10 questions that can lead you to healthy choices. Brought to you by the Aging and Brain Health Alliance at Rutgers University-Newark and the Department of Pathology, Immunology, and Laboratory Medicine at Rutgers, New Jersey Medical School.
Hi, my name is Alicia Codrington. I am a PhD candidate in Infection, Immunity, and Inflammation track at Rutgers School of Graduate Studies. Black and African Americans are 4 times more likely to be hospitalized and 3 times more likely to die of COVID-19 than white and non-Hispanic populations. And this is predominantly due to pre-existing conditions such as heart disease, diabetes, and other conditions that compromises the immune system. Researchers such as myself are working really hard to learn as much as we can about this virus. There are no absolutes, but I'm excited, very excited about the fact that we have some vaccines that are out. We can reduce the spread of this virus and possibly eliminate it, but only if we all take the vaccine. I am grateful to God now that we have a vaccine that can help us become immune against this virus. Like all of you, I too am looking forward to returning to living our lives again without masks and social distancing.
This presentation will answer 10 key questions. Why are older African Americans at high risk for COVID-19? How do the 3 vaccines differ? Are they all safe and effective? Have they been tested in African Americans? Can I expect any side effects? Can the vaccines give me COVID-19? If I previously had COVID-19, do I still need a vaccine? After the vaccine, then what? How else can I boost my immune system to stay healthy? What are the long-term consequences of COVID-19? Let's turn now to question number 1. Why are older African Americans at high risk for COVID-19? Age is a big factor. Our immune system gets weaker as we age and less able to recognize and fight viruses. Social and economic factors. Many African Americans live in crowded urban neighborhoods, have jobs that cannot be done remotely, commute to work using public transportation, and have less access to high-quality health care. As a result, African Americans are more likely to get infected. Health factors. African Americans have high rates of obesity, hypertension, which is high blood pressure, diabetes, and sedentary lifestyles, that is, insufficient exercise and poor physical fitness. All of these weaken our immune system and contribute to more severe COVID-19. So there are really 2 health disparities with regard to African Americans. African Americans are more likely to get infected, and if they are infected, they're more likely to get severe forms of COVID-19. The good news is there are now 3 vaccines, the Pfizer and Moderna, which came out initially, and more recently the Johnson & Johnson vaccine. Although they differ in how often they're dosed and some of the details of how they were made, all 3 have been tested collectively on over 100,000 people before they were approved to be used in the public. All 3 are very good at protecting us from serious illness. Now, you might ask which one is better, but it's hard to compare because the Pfizer and Moderna vaccines were tested early in the pandemic in 2020 when there was only 1 strain of the coronavirus. In contrast, the newer J&J vaccine was tested more recently when there were newer, different variations on the virus, so a more challenging environment. Thus, it's very difficult to compare the efficacy of these different vaccines because any of the reported differences you may read about also reflect when they were evaluated. But the bottom line is all 3 are very good at protecting you from serious illness. The newest vaccine, the J&J vaccine, however, has 2 practical advantages. The first is you only have to get 1 shot rather than 2. And the second is it does not need deep cold refrigeration, so it can be given more easily at places like pharmacies and stores, or even brought to your home. You might ask, but have they been tested in African Americans? Let's ask an expert.
Hello, I'm Dr. Sharita Golden, Vice President and Chief Diversity Officer for Johns Hopkins Medicine. Many of you have asked us questions about what was the demographic makeup of those in the trials. And so, in fact, we know that in the Pfizer vaccine trial, that 10% of the participants were Black and African American, and all of those participants were recruited from the United States. So that was about 4,000. In addition, there were about 26% of those participants who were Hispanic or Latinx, so a little over 11,000 participants. And then we know that Asians accounted for 5% of the participants in the Pfizer vaccine trial. Moderna trial, there were over 30,000 participants. We know that 10% of them were African American, so about 3,000 participants. We also know that about 20% of them were Hispanic and Latinx, and that was about a little over 6,000 participants. So we hope that this was useful to you in answering some of your questions about the vaccine trials.
Are there bad side effects to these vaccines? Well, there are two types of side effects. There are the short-term side effects that happen soon after you get the shot. There may be a little arm soreness and some swelling. And then the next day, some people, but not everyone, might have some fever, some chills, some tiredness or headache. But that's good news. That tells you that the vaccine is working, that your body's immune system is learning to recognize the virus. So give yourself the day off. Let your immune system have the day to do what it should do. Can these vaccines make me sick with COVID-19? Absolutely no. These vaccines are very safe because they only teach the body to recognize the spike part of the virus that causes COVID-19. None of them contains the actual virus. 7. If I previously had COVID-19, do I still need a vaccine? Yes. The vaccine may give you stronger and longer-lasting immunity than the disease itself. But talk to your doctor if you recently had COVID-19 or recently had any other vaccines. Okay, I got the vaccine. After I get the vaccine, what next? Well, the answer is after you get the vaccine, you want to keep practicing the 4 W's. These 4 W's are wear a mask in public, watch your distance, wash your hands, and wait 2 weeks. Wear a mask in public, watch your distance, wash your hands, and wait 2 weeks. Because after 2 weeks, you'll be fully vaccinated for COVID-19, and at that point, it's okay to socialize without masks with others who are also vaccinated. The other thing you should do is tell all your friends you got the vaccine. Become a vaccination role model for your community. How else can I boost my immune system to stay healthy? Well, other than the vaccine, there are some other things you can do to stay healthy and have a strong immune system. These are lose weight, reduce blood pressure, sleep well, relax and avoid stress, eat light and healthy, exercise and stay fit. Now, for those of you who've been to some of our Alzheimer's awareness and brain health and aging smart events over the previous years, these 6 items of advice for a healthy immune system may be a bit familiar. And that's because these 6 steps are exactly the same steps that also can cut your risk for Alzheimer's disease in half. And that's no coincidence. And the reason is that good immune health equals good brain health. Losing weight, reducing blood pressure, sleeping well, relaxing and avoiding stress, eating light and healthy, and exercising and stay fit will both be good for your immune health, but also good for your brain health. The last question: what are the long-term consequences of having had COVID-19? What will happen years in it after someone has had COVID-19? Well, since COVID-19 has only been around for the last year, we do not know. But only by doing research studies can we find the answers, and from these answers, learn how to best help people who had COVID-19. So you might ask, how can you contribute to the fight against COVID-19 and against Alzheimer's disease? Let's ask Dolores Hammonds, a community brain health educator with the Rutgers University-Newark Aging and Brain Health Alliance.
My name is Dolores Hammonds. I work for Rutgers, brain health educator. A lot of people don't understand what COVID is and how it affects them. So being that I have had it, I can talk to them more about it and let them know what it does to your body and how it affects your life. Down at Rutgers, where I work, we offer things for my African American brothers and sisters. And then the research come about, because the research can be able to help you. And if it don't help you, it will be able to help someone to say, this is what we have and this is what we can do. Because if you don't go for a research, we will never know what we can do. I mean, when you take any medication that we take today, somebody had to do a research on it. And I think it's so important that the research is done. And to me, I feel great about the fact that they asked me to do this. And I might be able to help somebody or help find a cure. And it would be done came from me.
These research studies are called Pathways to Healthy Aging in African Americans, a university community collaborative study, because we want to understand the pathways by which people can become healthy and stay healthy throughout their lifespan. These studies are funded by the National Institute on Aging, which is part of the National Institutes of Health. You can join the fight against Alzheimer's disease and COVID-19 by becoming a paid participant in research on aging and brain health at Rutgers University-Newark by calling 973-353-3673 or visiting our website at www.brainhealth.rutgers.edu. If you are African American or Black and age 60 or older, please call us, leave a message. We will call you back to tell you more. Then you decide for yourself if you do or don't want to join the study. It's always your choice. Participants in the study can earn up to $200 plus transportation costs for 3 visits over 3 days in Newark. To help us better understand the impact of COVID-19 on older African Americans, we are seeking new participants in the Pathways study, especially if you are hospitalized with severe COVID-19, if you previously tested positive for COVID-19 using a nasal swab or saliva test. We want both those who had no symptoms and those who got sick. And lastly, if you experience symptoms since last March, such as fever, difficulty breathing, loss of smell or taste, or deep fatigue that suggested you might have had COVID-19, but you're not sure if you did, call us as well. We're interested in all 3 types of people and their different experiences with COVID-19. So if any of this applies to you and you're interested in participating, call and leave a message at 973-353-3673. That's 973-353-3673. This video was created by Dr. Mark Gluck, Professor of Neuroscience and Public Health and Director of the Aging and Brain Health Alliance at Rutgers University-Newark, with Dr. Patricia Fitzgerald-Bocarsley, Provost at RBHS Newark and Professor of Pathology, Rutgers, New Jersey Medical School, with the assistance of Diana Grass, an undergraduate honors college student in the Gluck Lab at Rutgers University-Newark. For more information about the Aging and Brain Health Alliance at Rutgers University-Newark, check out our webpage at www.brainhealth.rutgers.edu or call and leave us a message at 973-353-3673. Thank you so much for your time today.